Ladder 41 to locate it, find the inferior border of T2 and come directly lateral to it, 3 sun lateral to the posterior midline.
Small intestine 9 is located on the posterior aspect of the shoulder, about 1 sun superior to the posterior axillary crease. How do you find this 1 sun? Well, it's important to place this point inferior to the inferior border of the deltoid. To bring this into relief, the person can push their arm backwards. You're feeling for a nice soft area below the muscle. It's important to remember that when you finally locate this point, you need to be completely parallel to the part of the body you're working on. Small intestine 9. Small intestine 10 is located on the posterior aspect of the shoulder. It's directly superior to the posterior axillary crease and inferior to the lateral extremity of the spine of the scapula. Find small intestine 9, come straight up, feel for the spine of the scapula, and then come back down into a nice dip to find this point. You're not on the bone and you're not on the deltoid, you're in a nice dip. It's important to remember that to find this point accurately, you need to be standing parallel to the part of the body that you're working on. Small intestine 14 is located 3 sun lateral to the inferior border of T1. Locate your T1, move 3 sun laterally. The 3 sun at this level is dictated by the medial border of the scapula. Sanjiao 14 is located inferior and posterior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm and palpate in between the heads of the deltoid to identify the anterior, lateral and posterior heads of the deltoid. If you push forwards, you should be able to feel the bony extremity of the acromion process. Sanjiao 14 is inferior to the acromion process in between the posterior and lateral heads of the deltoid. It forms a nice curved line along the edge of the acromion with large intestine 15 and small intestine 10. Sanjiao 15 is located in the suprascapular fossa. It's halfway between Do 14 at the base of C7 and the lateral extremity of the acromion. It's also located halfway between gallbladder 21 and small intestine 13. Large intestine 15 is located anterior and inferior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm, extend their arm and palpate for the clefts between the anterior, lateral and posterior heads of the deltoid. If you push medially, you should be able to feel the bony extremity of the acromion process. You need to locate this point inferior to the acromion process between the anterior and lateral heads of the muscle. Mark this point when the arm is then relaxed. Large intestine 16 is located on the superior aspect of the shoulder. It's in a depression which is medial to the acromion process. It's medial to the lateral extremity of the clavicle and the spine of the scapula. palpate to find a nice dip. This point isn't on bone, it's in a nice dip. Gallbladder 21 is located midway between Do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjiao 15 and small intestine 13. Gallbladder 21.
Sanjiao 4, which is on the dorsum of the wrist, in between two tendons, extensor digitorum communis and extensor digiti minimi. I'm popping my point in.
Sanjiao 9 is located 7 sun proximal to Sanjiao 4 on a line heading towards the lateral epicondyle of the humerus. It's located in between the radius and the ulna in a nice groove between two muscles.
Sanjiao 12 is located 4 sun superior to Sanjiao 10 on a line connecting Sanjiao 10 to Sanjiao 14.
Small intestine 2 is on the ulnar aspect of the little finger in a flare just distal to the base of the proximal phalange in here. Small intestine 6 is located in a groove in the high point of the styloid process of the ulna. To find this groove, rotate the arm up onto the body. When you do this, you'll find that a tendon moves out of the way to reveal a nice groove in the bone. Be careful not to come too far radial or you will come off the bone completely. Actually find this point level with the high point of the styloid process, but in that groove. Large intestine 10 is located 10 sun proximal to large intestine 5 on a line heading towards large intestine 11. Palpate along that line and fall into a nice groove in the muscle at 10 sun. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Large intestine 12 is located 1 sun superior and 1 sun lateral to large intestine 11. Palpate for a nice groove.
Large intestine 13 is 3 sun superior to large intestine 11. It's between the lateral borders of biceps brachii and the shaft of the humerus. If you divide the distance between the anterior axillary fold and large intestine 11 into thirds, point just lies there.
Lung 6 is located 7 cm proximal on a line from lung 9 to lung 5. Lung 7 is located 1.5 cm proximal to lung 9. It's located just a little lateral to the main line running from lung 9 to lung 5, in a cleft between the tendons of abductor pollicis longus and brachioradialis. It's located just at the base of the flare of the styloid process of the radius. In this position, the point is just about visible on the corner of the arm. If you locate the point too radial, it's falling onto the yang surface of the arm. Lung 9 is located on the lateral aspect of the wrist flexure, in between the radius, the scaphoid, which is one of the carpal bones, the radial artery, and the tendon of abductor pollicis longus, which is this big tendon that can pull the thumb out. So find the dip between all those three landmarks and the radial artery and mark your point there.
Heart 2 is 3 cm proximal to heart 3, in the groove medial to biceps brachii.
Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Spleen 5 is located in a depression which is anterior and inferior to the medial malleolus. Trace along the anterior border of the malleolus and the inferior border, and then palpate whilst you articulate the foot. Feel for a nice dip. Spleen 5 is in that dip. Spleen 7 is located 6 cm superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having difficulty identifying the medial crest of the tibia, just raise the leg slightly and the flesh will fall away from the bone. Remember, it's half of your patient's finger breadth, not your own.
Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.